Welcome to this special lunchtime conversation on the rural and urban divide. This is a collaboration between the American Portrait Initiative from PBS and WOSU Public Media. I'm Adora Namigadde, and I'm a reporter for 89.7 NPR News. I'll be moderating today's conversation. American Portrait is a storytelling initiative that lets people all over the country upload their own video stories, texts, or graphics in response to this question. What does it mean to be an American today? We encourage everyone to visit the website, wosu.org/American Portrait to participate. Well, what does it mean to be an American today? Some say that it means people in rural Ohio and people in urban Ohio are very different. And some say that that statement is actually a myth. We're here today to discuss that. With an eye on issues like employment, education, and healthcare, let's talk about our differences and our similarities. What are the myths that exist, and why are they there to begin with? Before we start, a little housekeeping. During our conversation, we will accept questions from you, so please use the Q&A function on Zoom. WOSU Public Media content producer Leticia Wiggins will select the questions most relevant to the discussion. Now let's get to our guests. First, Dr. Jackie Wilkins is the Associate Dean and Director of the Ohio State University Extension. Devontae Haynes, PhD candidate at Ohio State, and he studies college readiness for urban and rural populations. Then we have Dr. Shante Albert, who is the Associate Vice President for Health and Wellbeing at the Ohio State University Office of Student Life. Let's get right into it. What are the common myths we see, panelists, about urban and rural Ohio?
I think some of the ones that we hear oftentimes are that cities are not safe and people don't tend to know their neighbors in urban environments. Cities are poverty stricken and don't have access to quality education. And sometimes cities have too much or more than their share of government funding is another one that we sometimes hear. I think as it relates to rural, what I hear a lot is that they live in the country, so food must be abundant and easily accessible. Everybody absolutely knows and interacts with their neighbors. And then people should be able to pull themselves up by their bootstraps, are typical types of things that we hear people say.
I think on the healthcare side, people believe that within urban areas, healthcare is considerably better. In some areas it is, and in some areas it's not. I think there's a lot more similarities in things that within population health are very, very similar when it comes to health disparities, when it comes to access to healthcare, when it comes to those who live in certain communities being able to see providers who look like them. The same type of recruitment and retention efforts are just as tough in both urban and within rural areas. And so within healthcare, there are differences, but a lot more of similarities than differences, at least from my perspective. And if we go down the pipeline, when we look at within college health, some of the same concerns I experienced at my previous institution, which was a rural regional campus in Washington State, versus here, very, very similar health disparities and concerns around student health and well-being. And so that's been my perspective. And so, yes, I've stayed in both rural campuses and at urban campuses, and a lot of the things are very, very similar with the students I've served.
And so I would just add, in terms of the education space, I'll echo pretty much everything Dr. Wilkins and Dr. Albert said, but I'll add that typically we hear things about students who come from urban centers have more access to education. Because oftentimes you see higher education institutions within those areas. But when you look at access and students that are enrolled in those institutions, there's still that gap that we still see within our urban centers and our rural centers. And so that gap still exists. And then another problem that we also hear a lot is access to resources. However, we know both in our urban and rural areas, there's still a transportation issue. So residents within our urban areas still do have transportation issue with getting to those resources, even though they may be closer to them.
Okay, it's interesting that all three of you brought up access as something that is considered to not be had either in urban areas or rural areas, but that is also something that people struggle with in both urban and rural spaces. And so I'm wondering, what does lack of access look like in urban areas versus rural, and how does it differ in urban versus rural areas?
In terms of access, I guess from the education side, an example that I will give is if we go back to this time last year when all of our schools in Ohio went remote, there was a big thing that we noticed quickly, which was an access to technology services, access to internet. That was not just something that we experienced in our rural communities, but we also experienced that here in our urban communities. A lot of students didn't have access to high-speed internet to be able to log on to do their coursework. A lot of students didn't even have a computer in their home, both in our urban and rural communities. And so there was a lot of going back to figure out how do we get those technology services to our students to be able to continue their education. And so oftentimes, if you look back at some of the articles that was written, when we talked about that problem in rural communities versus in urban communities, it was framed differently. But at the core of it, it was still that same problem that exists for both of those communities.
Mm-hmm. And then would Dr. Shante please touch on access in healthcare, since you mentioned that big gap?
So this is my second month here at Ohio State, and I will say my experience of dealing with COVID within the institution of higher education is there's a stark difference. The biggest concern at my previous institution was there had been some hospital closures in some of the surrounding areas, and we know with the lack of expansion on Medicaid in some areas, a lot of hospitals in some rural areas have closed down. And so for us, you see at a lot of regional campuses, those institutions of higher ed, their student health services, if they have one, are doing a lot more primary care than other facilities may do, just because they can't necessarily refer their students out. They may have no insurance. And so the access there was very different, as we didn't want to bombard our small local regional hospital as they became an overflow unit for Seattle. And that became the priority for the hospital system. So it was very daunting on the front end to make sure we had some protective factors in place for students, making sure we can fully serve them, knowing that they would have a little bit more limited access to the local healthcare system. Within the urban area, not quite the same, but the access was still a concern there. While Ohio State requires students to have some type of insurance, that kind of levels a little bit of the playing field so they can utilize services here on campus and within the community. But again, access to get there. Some students from rural areas may not have used public transportation. Some within urban areas have never used public transportation. They maybe have used Lyft or Uber or something like that. But again, access is everything. And then the overall cost of healthcare. There are still people, students included, who have to choose between paying bills and other amenities for their daily basic needs in urban and rural areas that impact, do they go to the doctor? Do they go to the dentist? Do they go for that well person checkup? And so that hasn't changed because the cost of healthcare is drastically increasing on a consistent basis. But what I've learned in my time in rural areas is that those with pre-existing conditions tend to not go, not necessarily because they don't want to go, but the access, the cost have been a really huge concern. But access changed with COVID, thanks to telehealth and access to teletherapy. But going back to what Devontae said, do they have the technology to use those services? Some don't even have smartphones. And so those are some of the things I've noticed between my two campuses that I've worked at. And then also access to the COVID testing. A lot of our materials got sequestered versus here, they've been able to do a very robust testing plan, which is amazing to see in action, where at my previous campus, that wasn't an option. We struggled to get testing supplies consistently without the government taking our material. And so we were at the mercy of the state and at the within the public health department. And the public health department here was really funded well versus in a lot of urban areas. Some are funded well, but a lot of rural areas don't have full funding for their public health facilities and departments. So it really is a funding concern overall, which impacts access at the same time.
And access, just to follow on that, as you mentioned, hits so many different aspects of this. And so there's access, especially when you're thinking about rural communities. Many of them at this point in time either have a singular hospital or no hospital within driving distance. And being able to have the transportation because they don't have some of the bus lines, or even in some of the suburban areas, the lines that go where they need them to go to be able to access that at the time and place that it's needed. That telemedicine's a really huge opportunity, as Shante said, but we've got a variety of funders federally that are trying to make the equipment available, but they're still not in many of the places. And then there's still the issue of, do you have primary care physicians or others who are willing and able to serve those populations when there's so much demand across the state?
just one more thing. The reimbursement rate for telehealth and teletherapy is not at the same amount of what you would do at a primary care face-to-face appointment. And so that does impact whether providers in the clinical areas actually want to move to this as an option when they are not being reimbursed at the same amount when they would see patients face to face. And so then you start making it about a bottom line decision, and that is so much of the problem here is that it becomes a bottom line decision, and that's concerning when the whole purpose is to make sure everyone can have access based off their availability and need. And when providers get to choose that they'll see patients face to face post COVID because it's going to be a better reimbursement rate, that will be another problem that we face.
Thank you, everyone, for your input on what's going on with rural and urban access to healthcare. I think it's a particularly interesting point that telehealth has expanded access overall, but at the same time, who actually has access to that more accessible route of healthcare? So very interesting points. And now Leticia has another question for us from the audience.
Yeah, so somebody was curious, and just to get personal, and I know you've all elaborated on this a little bit, but they were wondering, are any of the speakers current or previous residents of a rural community or maybe urban community? And if you wouldn't mind just sharing a little bit about yourselves and maybe what got you interested in this work.
Shante is nodding.
Yes, so I went to my undergraduate institution, which is considered East Carolina, which is a rural institution, rural area. Main hospital was right there with the university. It was considered an academic medical center, just like here at Ohio State with the medical school, dental nursing program. And then at my previous institution in Washington State, it was considered a rural regional campus. And so I spent over almost 10 years at East Carolina and in the community within Greenville from undergrad, started grad school, and then worked there for about 5.5 years. And so, yes, I've experienced rural, but I would say my previous campus that I just left was even more rural. We didn't have a local Target or Walmart, first world problems, I know, but again, no amenities. There were no providers of color that looked like me in the entire county. We didn't have a psychiatrist in the county. And so those were some of the concerns.
I grew up in a variety of rural settings. As I was growing up, I lived in a lot of different places in Northeast Ohio. The one of most consequence lately is Litchfield, Ohio, which has a very small number of individuals living there still. I was probably in rural environments up until the time that I went to college in Columbus when I turned 18. And then I was in that rural environment in Franklin County for about 17 years before we moved back to northern Ohio, northeastern Ohio. And I currently live in a suburb. But I can remember things, just as you mentioned, Shante, access to groceries. We had an A&P and one convenience store, right, that we got to go to when we got that, I'll show my age, 25 cents a week to go spend that allowance, right? But access to doctors, those were things that you only you went to if there was something very, very significant because of the cost and the time being able to go. My mom, who still lives in Litchfield, thinks about that 20-minute drive as going to the big city from Litchfield. And so she tries to do that once a week or once every 2 weeks. And so again, figuring out what that accessibility is and the differences when you're in the, I guess the reason I'm most interested in this rural urban interface is being with OSU Extension. We have 800 individuals that are within counties across the state of Ohio. And all of those, that's the different continuum of that rural urban interface all the way across the state. And just thinking about what those challenges are, both similar and dissimilar, and how do we begin to work together for solutions on that is something that we are facing every single day. As you mentioned, the medical and the internet and the food security has really been exacerbated right now during COVID. And I'm glad that we're all paying attention to this.
So my background's a little bit different. I am originally from Detroit. So I've lived in the city all my life, originally from Detroit, and then I moved down to Cleveland, spent some time there before coming down here to Columbus. So I initially came to Columbus for undergrad. And during that time, I actually worked for the Department of Social Change here at Ohio State. And one of their big missions was really working with and bringing the urban and rural community together. And so we did a lot of work down in Benton County. And so I really got exposed to the Appalachian region of Ohio. And having gone through high school in Cleveland, I've never learned about the Appalachian region. They don't really talk about it. And so there's a lot of people who grow up in Ohio who are really just unaware of the Appalachian region of our state, which is very unfortunate. And so through my work with that particular department here at Ohio State, I learned a lot about those areas. But then I also was able to see some similarities in the students that I was working with there, and some experiences that I had experienced in school, in the community. And so starting to see a lot of that. And so I was fortunate enough through student life at Ohio State to create some programs that really brought urban and Appalachian students together, to have some of those experiences together and talk about some of those commonalities that they share. And from there, I really got more interested in that work and really looking at how do we bridge this urban rural divide, and leverage some of the resources to support both of those areas. And so that's how I really got into this work and this background.
Devontae, what were some of those similarities that students from both rural and urban areas had?
So in terms of a lot of the work that I really did with them was education based. Looking at the quality of the education within the schools, how the schools are resourced and funded. As we know in Ohio, our schools are funded very controversially. So really looking into that, but then looking at some of the implications for that, looking at the programs that those schools offer. A lot of our students talk about how they didn't feel prepared when they came to Ohio State because they didn't have certain AP courses or IB courses in their classes that when they get to Ohio State, their peers had. They talk a lot about when they came to Ohio State, they were learning materials for the first time that some of their peers were relearning for the third or fourth time. And so some of those struggles. But then also when you branch outside of the school and you look into the communities, some of the problems that we see that are happening both in our urban and rural communities, that also can affect the students, their ability in school and out of school. And so in our rural communities, we hear a lot about the opioid crisis and the drug epidemic. But then when we look at our urban communities, we do have some of those similar problems that are going on in those communities. And so there were some similarities there. Looking at home structures that some of our students were coming from. Oftentimes in our rural communities, we hear a lot about some of our students who were being raised by aunts, uncles, or grandparents. Again, that's something similar that we were seeing with some of our urban students. But then also just activities and different options for them to be able to engage in and do outside of school. The lack of different options for them, or the ability for them, again, to get to that. As I mentioned earlier, some of those transportation issues. So really just being able to provide them with opportunities was something that they was really looking for in both our urban and rural communities.
And what does the crossover end up being between the urban and rural populations? I'm very interested in if any of the panelists found that urban students think one way about rural students, or rural students have certain thoughts about urban students, and how are those myths busted between those populations?
I think when it comes to, from my experience, oftentimes they're not making assumptions on, who's rural, who is urban. What a lot of the programs I see in higher ed, they group them by identity based, but also those who are heavily needed to be resourced. And so you see a lot of the first gen students, regardless of where they're from, coming to the table, having similar conversations on how they all work to support themselves and their family. They're all the first in their family to attend college. They're all, all those things that make, the experience of attending an institution of higher education. So in those settings, when they have a really good, robust onboarding system at institutions, they find themselves having more in common. But I won't say that they're not going to look at the divide between urban and rural, but that tends to happen when it comes to other identities such as LGBTQ plus, race and ethnicity, religion. Those things come up when they make assumptions based off those other sometimes visible differences. But in my experience, I have yet to hear somebody say, well, they're from the country or they're from the city. But they tend to assume those from the city are just a little bit more exposed to things versus those who are in rural areas are a little bit more sheltered. But that's not the case in my experience once you get them to the same table and they start having conversations on how they have grown up and how they've experienced life. But I would say one big commonality is SES, regardless if they're rural or urban. How they are able to support their family's basic needs is where you can sit down and see so many similarities between students. So it doesn't matter where they are from. They've all had that struggle, as Jackie mentioned earlier, that bootstrap mentality is both urban and rural. But when you start adding other identities to it, it's a little bit nuanced because we've made it that way. Those of us who are adulting have made it a conversation piece. But I have yet to see students come to the table the same way with those same type of predispositions on what they believe their peers are coming to campus with.
I was just going to add real quickly that I would echo everything Dr. Elbert said. In my experience of working with students, oftentimes it's not the students who are separating themselves out. It's oftentimes the institutions and the adults that are really separating them. And so when you're constantly being told that you're so different and you're constantly reading about that, then you start to manifest that and you just start to believe that you're different. And every time I bring students together from urban and rural communities, there's never been a problem. They've talked, like Dr. Albert said, they sit down, they start talking, and then they realize where all these similarities are. And they realize that they have a lot alike, more than they previously thought, or more than they've been previously told.
I was just going to say the same thing. I think it's less about them personally identifying how they're different and some of these different, especially issues related to advocacy and what might be needed for first generation students. I think if there's any kind of a difference or a need, both similar and dissimilar, is to figure out where those opportunities for knowing how to advocate for those similar types of resources are, and to make people aware of it and the students aware of it. I've seen most of the difference in the perception of what they think might be different, having not actually experienced the difference, right? And so we've had a lot of interesting exchange opportunities where youth from a rural county would go visit and do an exchange in programming or opportunities for a tour or an experience, for instance, in the city versus in a rural space. And oftentimes they'll find, like you said, especially if you're doing it together with that exchange, a chance for that opportunity to see those similarities. But it's more a fear of what I can remember, for instance, when we thought about driving to Cleveland from Litchfield. It was a long drive. We didn't take it very often. We didn't know where to park. It was more that inexperience with how to navigate some of those spaces and and where to go and what to do. But a real joy in figuring out that and being able to do it more effectively each time.
And then learning how to navigate that space helped you overcome that fear?
Absolutely, because a lot of it is, I mean, a lot of it comes down to where are the resources, right? If I have to get to something, where is it? If I have to park, where should I be? If I'm going down the one-way street I don't even know what a one-way street is at this point, what does that look like? So I think it is just that navigation and having an opportunity to, as you mentioned, it's almost, I hate to say it's dosage too, but I think with increasing dosage and opportunities to be able to engage in some of the exchanges in time and space in different places really does help out.
Mm-hmm. Thank you, everyone, for answering that question. Now, Leticia has another question from the audience.
Sure, and I just want to thank the audience for all of these really insightful questions. It's always difficult to choose, but I wanted to go with one from Beth a little earlier, and I think it plays off of these assumptions we see maybe from schools, but also this is like a larger nationwide assumption. And Beth says the assumption or myth seems to be that all rural people vote red and that all urban people vote blue. What is the reality of this, and what do you see people in both areas agreeing on?
Well, I haven't, at my previous institution, I have taught how people vote, not necessarily where they stay at, but based off the progressiveness of the area. So we can be in a rural area, but have an institution of higher ed, and most of those people in that locality will vote for something more progressive, which at this moment has been on the Democratic side. Not to say that Republicans haven't had a progressive agenda on some healthcare concerns, but I will say I've seen it tied to where are the institutions of higher education located, and that tends to be where people are starting to vote based off how the parties are putting things on the table and addressing what we consider to be major concerns that impact our health and well-being. But yes, there is still some states that are considered more rural, that you still see more red than other areas, but they have institutions of higher education in those states. But it really just depends on the people. And you're going to have to go down the line and go a little bit back down the demographic line to the history in those states and how they've addressed things. And that may answer a lot more questions other than, if I stay in an urban area, I'm going to be Democratic. If I stay in a rural area, I'm going to be Republican. For me, it hasn't been the case. Wherever I've worked at with the institution of higher education, that area has been predominantly more progressive because of that institution and been a lot more on the blue side of it. But that can vary everywhere. I mean, there's always outliers to that. But I'll let Jackie or Devontae add, but that's just been my experience that no matter where I was, two rural, two urban campuses, didn't really matter.
Yeah, I would follow along with that. I think if you look at, I mean, all it takes is looking at the electoral maps as we look at each election, and they go deep into each county, and you see the difference within each county, within each state. It really is not homogeneous, right? There's a lot of heterogeneity across each of the counties, and so if you dig within the state, you're going to see that that diversity. And I agree with Shantae. I think a lot of that you do see within the areas where there is a university or a college included with some of that progressive thought. But in each and every one of those, still, when you think about that political landscape and what matters to each of them, it still really all comes back to health and social equity and having your basic needs met. And so while there may be differences in within and across blue and red states, there's definitely a common interest, whether we go about it in different ways within different communities and different aspects of that.
Thank you. Thank you for answering that question. And I just want to remind everyone that they don't have to allow the national dialogue to define themselves. So please go to pbs.org/American Portrait. Again, pbs.org/American Portrait to submit your own stories and upload your own stories about your experiences in rural, urban America, whatever it is. We would like to hear from you and add that to our archive. The next question I'd like to ask is taking that last question, but delving more deeply into Ohio. We were talking more broadly about the county maps and where there are red areas, where there are blue areas. What do you three find with students at Ohio State in particular in terms of that urban and rural divide as it applies to politics?
In my 2 months here, I have yet to hear from students anything dealing specifically around politics. The students right now are really concerned about themselves and their peers' health and well-being. And no politics has come into it. It's really just, I care about the person sitting beside me in class or on Zoom with me in class. And there has been no, as we call it, politicking in the conversation at all. It has been, Dr. Elbert, you're here. How can we make sure when our peers come back to campus, they can be fully served? And so I haven't seen it in my 2 months here. It hasn't become a political dialogue. But what I have seen is the desire to address the equity in how we approach this. And so that, we see the whole student, and that means all the identities that they come to campus with. And so for me, it's been refreshing to see students who are really focused on not only coming back to campus, but making sure that when them and their friends get here, that they can be fully served by our campus services, if not also how we refer them out to community resources. So I haven't seen a very strong political conversation quite yet in my 2 months of being here. It has been really strong on how do we serve them when they get back, because they may come back with some more disparities, concerns around mental health and wellness, basic needs and access. And so that has been hot topic for me the past 2 months.
There was a point made earlier about wanting students to know how to advocate for themselves, right? And advocate for these things we were talking about, like health and well-being. So how do you let students know their options?
I was just going to say that when you asked the last question, that's why I was hesitating, because it really wasn't so much again about states and red states and the political divide as much as it was about looking at where some of that disparity is as it relates to readiness for college, or sometimes the how well prepared they are in developing that resume and the ability to have a strong application for being able to be on the campuses that they're most interested in, or coming to Ohio State in particular. And so one of the things that, and Shantae might not even know this yet, but we've been talking with a variety of individuals across student life and also the Office of Diversity and Inclusion to really focus on building some of the really great skills that have come through the Young Scholars Program to help youth who might first need to kind of see themselves as a first generation student, for instance, come to college. What does that look like? What coursework should I even be doing and preparing for? And what kind of experiential learning should I have? But that advocacy is really important. Somebody mentioned earlier about the differences in AP courses and the availability of some of those higher level aspects of technical writing skills and AP courses and honors courses, and in preparation for applying for and successfully coming to college. And I think if we can help students know that they don't have to wait for an adult to make that ask, that oftentimes if they can identify that as a need, express their desire for it themselves, and potentially get a group of students and community members that can really push for that access. And the way that we, in Ohio, again, everything's a little bit different by community and school districts, and how they approach how those dollars will be spent and how much they have to spend on them. But thinking about what that means locally and getting some advocacy, certainly student-led, I think, can be very powerful.
So I know for me, kind of in the space, so I do a lot of work with high school students, and so, or undergraduate students. And so kind of for me, that the big thing is kind of hearing them out, learning about them first, and then presenting them with all the options that they have. I think oftentimes it's hard for students to advocate for themselves because they don't know what options they have. So making sure that all those options are presented to them, and then refraining from putting my own personal opinion in there. And so, because I think oftentimes students feel that they have to advocate one way or another because someone that they see as a mentor or someone that they look at as this influential person is advocating for them to do this one thing or go this one path. And so making sure that I kind of lay out all those pathways for them and then support them through those paths either way that they choose.
I think advocacy for me really focuses on reminding them that they deserve to be here. So making sure they're not dealing with any type of imposter syndrome, and that they always can question, that they have space in every setting, whether it's a doctor's appointment, going to the dentist, in the classroom, outside the classroom with other administrators on their campuses, that they can always question. And so I really focus on making sure that students know they have the opportunity to go into those spaces and be inquisitive and build that critical thinking skills. And so for me, advocacy was a learned process. It is not one of those things that you just wake up and all of a sudden you're just a great advocate. A lot of it comes from experience. And it's that first time you had an experience that didn't go well and you wanted to advocate for yourself and you just didn't know how to. And for me, that was, as a plus size woman, going to the doctor and making sure they ask me, how am I doing, and not going right to how much I weigh. And then also within, I have a munchkin, my 2-year-old has Hirschsprung's disease, having to read up and learn about Hirschsprung's disease. So when I went to the doctor's appointment, I had my questions in my iPhone ready to go. But that is a skill set as a health educator I had, but teaching other people how to do some really basic research and go to their appointments ready with questions, and that they can also not like a healthcare provider and go find another one. And so for me, advocacy is just giving them the avenue that no is a word and yes is a word, and that they can always go back and forth within their systems and their community, and advocate for those who don't have the same voice, don't have the same access. And so I'm constantly reminding students, when you're in these spaces, ask the questions, ask for more information, and then make sure you, while you're at the table, you remember those who aren't and do the same type of advocacy for them. So that's how I've approached it over the years. But it started home with me, and it really resonated when I had to learn how to do it for myself first.
Thank you for sharing your own personal experience too with learning how to advocate for yourself and how you extend that to others. And now Leticia has another question.
So I'm going to try to compile a few questions here because there's been a lot of questions from different attendees about differences. Like, we're focusing a lot on the similarities. And when we hone on to the communities and maybe outside of education systems, right? What do we see as a difference on the communities? And somebody even asked, what is this us versus them mentality? And so this is sort of a broad question, but if you can think about it on the ground level, where do these come from? And what are differences between the two, even when we think about community organizations, support systems, environment? And so I know that this is about myth busting, but should we be sure to address some of these differences as well when we're trying to do this?
Yeah, I guess what I would say is I think a lot of this us versus them continues to come from how we portray things, especially in the media, in different areas where we're hearing this narrative about how we're similar or how we're different. And a lot of times the difference is the better story than the similarities. And so I think we get a lot of that exacerbates that, as well as political conversations and different hot buttons that have especially been exacerbated during COVID, for instance. I would say I think a lot of the difference, I mean, there are differences. We're not suggesting that everything is completely the same. There's a lot of similar types of considerations and concerns. I think there's nuanced differences in either the level to which some of those things happen. So for instance, when it comes to healthcare, 2/3 of rural residents say this is a major or minor problem where they live. And roughly the same number of people that are in suburban areas say that's not a huge problem for them, or not as big of a problem for them, but it's still certainly a concern, right? And the same thing can be said related to high-speed internet. So 58% of adults in rural areas say that it's a major problem. And then when you look at urban, it's about 43%, and suburban about 36%. So some of it's the nuanced differences, and some of it's the way that it looks or plays out, as we mentioned with rural communities. The access to primary care providers, for instance, and the need for telemedicine. Again, access to healthcare is important, but it looks different based on the level of resources that you might have locally and the access to it. So access and transportation looks very different in a rural community than it does in an urban community, but access to transportation is something that's a similar issue for both. So again, I think it's the different nuances, maybe the level of the consideration of how what percentage of people are affected by that, and then the mitigating factors that might be there, and the resources and the will to kind of change those things.
So some stark differences, obviously, when you look at some of the social determinants of health that impact urban and rural areas. While some are similar when it comes to access to physical activity, as we know, some urban areas have lost some green space. It is another concern in the rural areas also, as we look at what their major health concerns are, things that are, again, can be modified off of behavior change. So diet, exercise, ongoing appointments with the medical provider. But the concern I want to go back to, I mentioned, and Jackie mentioned also, the closure of hospitals in those areas, and even some clinics. And so again, if they have some in that area, it may drive up the cost. It may make a longer wait for an initial appointment, or, which is often happening, using the ER as primary care. And that can be an issue for a lot of rural areas, because again, they may wait till something has drastically happened with their health when they have to see someone. And so when we look at that, and we know that there are very little social components in some rural areas for youth, and those that want to get engaged with others in their age group, in those areas, we start seeing, again, the opioid crisis, high drinking rates. I know I was talking to my students, and they didn't believe that the rates of accidents in rural areas was higher than urban areas due to drunk driving. And so again, we have some things in certain age groups that are starkly different because of some social barriers and things things they can't do, that in some urban areas you can just go to a mall, or go to a skate park, or go to some other areas to get that experience. And so because of that, when we look at things that kind of culminate larger together, when we look at healthcare, let's go back to my emphasis on recruiting and retaining a diverse healthcare group of practitioners. And so in urban areas, we can recruit and retain them because they may hop from system to system, office to office. But I'll speak for me, it is hard to move to a rural area where I may be the only one. Or again, for me, where I didn't have any providers of color, and then there was one and everybody wanted to use them. And so it can be tough to retain them. And while there are things are out there where they can use to recruit and retain diversity within healthcare providers, it may not retain them for long, because they may get an opportunity to go somewhere, or for me, have a better opportunity for their family and their children to be in diverse areas, which was a concern for me. And I think for a lot of people don't recognize that within those rural areas, while many of us love this work, our families take the blunt of some of this when we take those opportunities. For my son, he was the only one in his class for the first time ever. And that was some growing pains for all of us to start to have the conversations around race when we didn't have to with him prior to us moving to Washington State. So it's a lot of factors that go into that. And so you can't forget that these are people moving to these areas to provide these services. So I am first a mom and a wife. And when my children are impacted because they're staying in a rural area, or when my son with Hirschsprung's gets sick and I'm worried about having to drive 2 hours to Seattle to the closest doctor, and when my doctor in Seattle tells me if anything happens, don't take him to the local hospital I need for you to haul it over here across this highway, which is a mountain, by the way. So there's some fear that goes with that. And so some of the differences people don't recognize when you have the urban and rural divide is that people are making life and death choices when they stay in rural areas on how long they can wait to go to see a healthcare provider. How long can they push it out before they have to take that once a week trip, or waiting for, in some areas, when a specialty doctor will come maybe once a week or maybe once a month to that area. So those are some things that are drastically different, where in an urban area, it may take you a while to see a specialist, but you can see one in a timely manner versus waiting for one to come into the area. So those are some concerns that I have seen and experienced firsthand. But again, you have to remember that the people providing these services are humans first, and they have to have lived experiences that are conducive to their own health and well-being. And when that doesn't happen, that will have a ripple effect on how people in that local community experience access to healthcare.
And I think so. I think Dr. Albert and Dr. Wilkins covered this really well. So the only two things that I will add to in terms of those differences that we see is when we look at employment opportunities, we hear a lot of times that a lot of folks don't want to go back to rural communities because they don't feel like there are employment opportunities there for them. So looking at how we can add more employment opportunities for some of our folks to go back to their communities, because oftentimes they want to stay in those urban communities for that reason. But then another big one that we really see that I hear about a lot is a lot of folks tend to think that folks in rural communities just has access to a ton of healthy food options and a ton of options to get produce and things like that. And it's actually the complete opposite. And so oftentimes what we see happening I'll use Vinton County, for example, down in Southeast Ohio. Vinton County just got their first supermarket about 2 years ago. So that their entire county did not have a supermarket. So folks were having to travel outside of their county to get produce. But then even in some of our other rural counties, a lot of folks are dependent on Dollar General or Family Dollar to get their produce, or they're having to travel an hour away to get produce. And that's not something that we see quite often in our urban communities. We do see that in some of those communities, but not as much as we see in our rural communities. So really thinking about how we're reframing access to food and making sure that we're not just assuming, because a lot of folks think that rural communities is just farmland, so they have this access to this food. That's not the case.
Well, and you make a really excellent point too, Devontae, about employment. I think along that line, a couple of things. One is the income that comes with that, right? And so even with a lot of our agricultural producers, oftentimes they also need to have a second income for the smaller farms. And so you'll see individuals that are both working a farm and then also having a second income. And that requires going into either suburban or urban areas oftentimes for those opportunities. And yet you still have a lower average income as it relates to rural versus the suburban, and oftentimes within the urban centers. And I think childcare is another thing that we didn't bring up, but I don't know. Everybody seems to assume that if you live in the rural areas, somebody in the family is going to want to watch the kids for you, or you have easy access to family daycare, and that's not always the case either. And so that provides a lot of additional considerations as it relates to being able to do that work and the employment and the impact that it has on the income for the family.
Thank you for saying that, Jackie, because I know one of the comments in the Q&A was that we focus on students, but we do know here that the traditional age student varies at some of our regional campuses. They may not be non-traditional students, which means they're working, supporting themselves, families, they may be caretakers. And so when I mention students, I'm looking across the whole age range, as I've had students who are 50 years old sitting in some of my classes. And the thing is, their literacy levels are often not too different, but their experiences they bring within the classroom is. And that's the best part of having diversity within the classroom, is that, you know, wisdom comes with some age and experience. And so they bring that in the classroom. But when it comes to healthcare, the same conversations I'm having with the traditional age 18 to 24-year-old student, it's the same of what I'm having with what we consider a non-traditional student who may be 24 plus. And so for me, when I say student, I'm talking in the broadest sense you can think of when I mean student. And that includes those like Devontae who are working on their doctorate degree and above the average age of a traditional college student. who may be for the first time experiencing healthcare concerns. I always think about that, the students who say, I just hit my master's program and dot program and my whole body changed and shifted. Well, welcome to adulting. And so we start talking about the things about having your well person check on a consistent basis. When's the last time you had blood work done? These are what I say to any student, because what I realize is that depending on the type of doctor they've had, or PA or nurse practitioner, it depends on how the conversations have been around health literacy, and what it means to have a well person check, and to have a full blood panel. Did they ask for one? STI checks. And so the conversations for me are very, very broad, and I don't group it based off age, because what I've learned over time is that the conversations are pretty consistent on making sure when I talk about access is knowing that, do you, as we used to say years ago, do you know your numbers, height, weight, blood pressure, glucose? That doesn't matter for whatever age. And I just had a conversation yesterday with some staff from the American Heart Association, and they was like, how do you get students, traditionally aged students, to understand that heart disease is a huge issue for their age group when they believe they're, healthy and they have no worries, but that it's a huge health disparity that they are having to look at when they see the increased rates of death or quality of life impacted through some type of heart disease or cancer. And so I think the reality for me is just to make sure people understand their self, listening to your body. Do you know how you feel? Do you know where to go when you need help? And that is across the board with age. And so for me, that's been a big conversation, whether I'm talking to an undergrad, transfer, a graduate, or professional student. They all need to have a higher level of literacy when it comes to how to access it on campus versus when they're in community. What does it mean to go see a specialist? Do you know what a copay is? Without having to pick up the phone and call a support person, because that happens in every age group. And so those are some of the things. And when I compare that to the rural areas, and I look at those students who may be, at least in my previous campus, a lot of them were migrant farm workers. And so they would miss classes at times to go and help parents within the season so they can bring in income and then try to come back to classes and work. And they often struggle. And so it doesn't matter if they're traditional age or non-traditional age. If they're having to support themselves, they're going to also have some other health factors that we want to be mindful of and teach them how to advocate for, how to get more scholarships so they don't have to hopefully work. And then again, Jackie mentioned access to childcare. Moving here, it was still a wait for me to try to find childcare. So those are some really high level concerns when it comes to how we want to address it within urban and rural areas.
I think one last area of differences that strikes me right now is related to COVID vaccinations. And when we're really starting to understand, especially when you have vaccines that need to be a certain temperature and how long they can be made available, and do people again have transportation and access to those, especially with our older adult population, trying to figure out how to navigate all of that to begin with. But I know, we are seeing some places like West Virginia, for instance, that are doing a great job with the pharmacies and the trusted individuals within the rural communities in particular, to be able to go out and have a mobile unit and be able to have those trusted relationships where they're able to increase the number of vaccinations that occur. But some of it still has to do with access and availability, transportation, and navigating systems that they haven't had to navigate before. And that's also true in urban environments, but there's a lot more potential places that you can sign up for a vaccine in the urban centers than you can in some of the rural environments.
I'm wondering if the three of you can talk about immigrant populations in rural and urban areas, whether you can just comment on that.
I would say from my experience working at 2 rural campuses, we had a lot of students who were, again, either migrant farm workers. At East Carolina, I worked in the School of Medicine and Family Medicine, and they had a program called ASU Salud, which was a way to train the medical providers to speak basic Spanish, but also work with the traditional healers in those areas to be able to provide culturally inclusive and competent care. It was one of the best experiences I experienced while I was in grad school and working with the School of Medicine, specifically family medicine, on how they trained the providers to go into those communities, especially since they did identify within those communities. And so I think that's the biggest thing with dealing with and appropriately serving those from migrant farm areas or other minoritized backgrounds is that we need to make sure that those that are clinical practitioners know how to effectively serve them. Such as, I mean, I remember the first time I went into a room, they was like, make sure you give direct eye contact and touch the patient. There are some spiritual and differences in how they engage in clinical care that doesn't necessarily show up in some areas. And so I believe that the differences in that is that we don't do enough training on culturally competent and inclusive care in some areas, and that we just have, this is my bedside manner and this is how I'm going to do it. But with migrant areas, there are some really culturally based, spiritually based things that need to be taken in consideration. Talking to the male, if there's a male in the room, direct eye contact. They do believe in Mao de Ojo, bad omen, bad eye. And so those are things I learned as a grad student, and I will never forget it. Make sure I look them in the eye, talk to them, touch the patient. Those are just basic things that people just don't do often. And so when it comes to serving migrant students, it's making sure that there's a translator on hand. There are certain things that we must have in place as just standard practice, but that is not the case when we serve migrant people. And so one of the things I loved about when I was at ECU, we went to the camps. We didn't expect them to come into the clinic to be seen. We went and set up camps there. We made sure we had space for the natural healers and also space for the traditional M1, M2s, and M3s who went out to that facility. It was an amazing experience to see, and I wish we did that more often in all healthcare areas. But for me, that's one of the best ways I've seen it done. And at my past campus, one of the biggest things we really try to do is get more Spanish-speaking practitioners in our counseling center and our student health. It was a struggle to keep some of those multilingual practitioners, but the more you can have people when they can talk in their first language, the better it can be for everyone. And then making sure that you have non-traditional hours outside of harvest season is going to be another one. So don't ask them to come to you when they are on a very short timeline to harvesting specific crops. And so I think the biggest thing is be sensitive that how we serve them won't be the standard practice and how we do it in traditional healthcare here in the US, and to be mindful of that.
And I think along that line, there's also, when you talk about migrant workers or immigration, that's, again, not a homogeneous population or group that we're talking about, right? So it depends on whether you have families that are moving to certain geographic regions and what are the resources that are available to them for employment opportunities, health and wellness, housing, things like that. And then if you've got migrant workers or seasonal workers, some of the struggles that they're dealing with right now have to do with work visas and the ability to do the work. And then if they're able to meet those needs by way of the employer, what are the opportunities for affordable housing and shelter, medical care, benefits, should they have them or not have them based on the amount of time and place that they're at. And then I think we've been working, to try and think about, you talked about culturally sensitive practices and language and translators. We've got a partner up in Columbus who's really wanting to make sure that the different resources that we have available in our Franklin County area really are thinking culture first, and what are the needs of those that are attending those schools, for instance, and how do we do some things that really meet that need and address that, as opposed to what can we bring to them that we already have, and here's what it typically looks like.
Thank you, Jackie. And with just a few minutes left, we have Leticia with another question from the audience.
Thank you, everybody. So just to sort of compound a couple of these in the little time we have left, we've focused a lot on education here, and it's because we all have fascinating folks from Ohio State University. But I was wondering if we could expand that and say, like, what are all of you doing within the communities outside of the college again, and thinking about that in the larger state context. And then a very basic sort of beginning question is defining rural and urban. So Steve asks, is it a city of 20,000 in a rural county? Is that urban or rural? Where do we draw the line? So that's something, just great to kind of end on that question as well.
So for me, outside of Ohio State, I do various things with the communities. So One, I have my own nonprofit that works with urban and rural communities, that's called Faces of Access. So really looking at expanding opportunities for folks within both of those communities, and bridging that divide. But then I also work with another nonprofit that works with youth across the Appalachian region, across the entire Appalachian region, actually. So it's 13 states, 420 counties, which is actually a mixture of urban and rural. And so I think that's kind of another myth. Everyone thinks that the entire Appalachian region is just rural, but there's major cities that fall within there, such as Birmingham and Pittsburgh. And so being able to work with youth and folks across those communities has really just broadened my understanding of that rural urban divide and some of the different contextual things that exist right there. But for your question in terms of how do you define it, I think that is actually a big question. Depending on where you look, everyone defines it different. Even here within the state of Ohio, even our state agencies define it different. If you look at Ohio Department of Job and Family Services, they define it one way. If you look at the Ohio Department of Education, they define it a different way. And depending on how you define it, you'll get different results based on what you're looking for. Even if you look at it right now, I think a lot of folks talk about it county-based. And so there's urban counties and then there's rural counties. And looking at that, I'm just going to use education, for example, because Ohio has this 65% attainment rate. They want everyone, they want all of their counties to have 65% of their adults to have some type of post-high school degree. So when you look at that at a county base, the results that you get are they're wide between urban counties and rural counties. However, if you look at that using census tract based data, then you're going to get completely different results. And so there's so many different ways that you can look at this. And I don't think there is one clear definition of what an urban community is and what a rural community is and what a suburban community is. And I think even in this conversation, we focused a lot on urban and rural, and we didn't really talk about that suburban piece, which also has a huge part in that, because oftentimes that suburban community is what is in between the urban and the rural community. And so really looking at how does the suburban piece also play a part into this.
Devontae, you're absolutely right. And I'm going to add to the muddiness of that definition of rural and urban, because it truly is defined differently. We have an effort in extension called Extension in the City. And just even the conversations about, do you call something city versus metro versus urban? You could debate that all day long across Ohio and nationally. Oftentimes we do look at how populous the cities are as it relates to whether they're considered a township or a city or a metro area. Ohio has 6 cities with populations of more than 100,000 individuals in it. And then we have more than 50% of Ohio residents living in 10 of the 88 counties. So you can see where a lot of the population within Ohio sits. But then you can get into the definitions of urban and rural that are defined by the physical population density and land use. What are the legal boundaries and government boundaries related to urban and rural? Then there's the functional aspect of that. What flows into what economically, cultural, as we just spent some time on, related to diversity and ethnicity, the environmental aspects of it, and like urban heat islands or industrial pollution. And then finally, the belief system gets layered in on top of that. And so there's a subjective judgment about what that means. And so one thing that we would say, which I know everybody hates this answer, is there's absolutely no right definition to define urban and rural. It really depends on the type of question that you're trying to answer, the problem you're trying to solve in that moment.
That's all we have time for this afternoon. We really appreciate you coming out, Dr. Jackie Wilkins, Devontae Haynes, and Dr. Shante Albert. And special thanks to Leticia Wiggins for monitoring the Q&A. And thank you to all of you for joining us virtually and for your engaging questions. We hope that you enjoyed this conversation and that you are inspired to visit our site, pbs.org/American Portrait, to share your own story about what it means to be an American today.